Please welcome Olaf Penack, Charité Universitätsmedizin, Berlin. The endothelium as therapeutic target in cellular therapies and stem cell transplantation.
So I'm what you call a physician scientist. So you've heard about very effective immunotherapies for cancer from my colleagues. I'm also faced on a daily basis by the downside of these therapies, because the major hurdle of these therapies, such as CAR T-cell therapy or allogeneic stem cell transplantation, which are the most effective immunotherapies against cancer, which we know today, is a high treatment-related morbidity and mortality. So for CAR T-cell therapy, we have to bring up to 50% of patients who are treated with CAR T-cells to intensive care units, and for allogeneic stem cell transplantation, we have a mortality up to 30% of which is treatment-related. So the current standard to treat with these side effects is to inhibit the hyperinflammation with steroids or other immunosuppressants, which has the down effect of tumor relapses and infections. So the really medical need is to develop therapies which are inhibiting these side effects, but which are non-immunosuppressive. And the vascular endothelium could be key to development of such therapies, because it's central to inflammation, to cancer growth, wound healing, and other important effects. So my group had a proof of principle study showing that you can inhibit angiogenesis, and this leads to a dual inhibition and reduction of tumor growth and inflammation, leading to survival benefits. Digging deeper into this, we could show that angiogenesis is the initiating process of inflammation, so it's not a secondary event in inflammation. And we could also already identify some pathways which are involved in initiation of angiogenesis during inflammation. But it's not only angiogenesis. You can see there's also pathologic vessel structures in organs during inflammation, and this has functional consequences. So there's vascular leakiness during inflammation, and we developed an approach to stabilize the endothelium with a drug called sildenafil. It's a PDE5 inhibitor, and we tried it in allogeneic stem cell transplant models and found better survival and less organ damage. Ongoing research in our group is to find a specific inhibition of pathologic angiogenesis to stabilize vascular leakiness, and also translational development, including biomarkers. Thank you very much.